I'm Dr. Stuart Firsten. This video demonstrates therapeutic procedures that can provide relief for common conditions, including upper and middle back pain, scapular and rib pain, and other muscular and myofascial related disorders. With the use of a specialized treatment table, manipulation or adjustment of the thoracic spine can be performed with the patient lying on their stomach. Other treatments may include mobilization, myofascial release, trigger point therapy, and deep soft tissue massage. By taking into account the normal biomechanics, the thoracic spine can be thoroughly and comfortably palpated, mobilized, manipulated, and adjusted. Manual therapy techniques are generally appreciated and well tolerated by most patients. They should only be provided by qualified practitioners. Such procedures serve to restore joint mobility, relax muscles, improve circulation, decompress impingement, and reduce irritation to nerves. Risks associated with thoracic manual therapy are extremely low.